Hello, everyone. Welcome to this program by Heartfulness and Brighter Minds. And a very happy evening. We are very happy to welcome you all here on this Saturday evening. And I welcome Mrs. Rama Shinde and Dr. Sagar Narori too for this discussion on a very important topic, healthy gut and sharper brain. So, you know what? Gut, that is our digestive system and whatever is inside our stomach, and our brain, they are like new couples in love. All the time they keep communicating with each other, sending messages to each other. But you know what, they don't send memes, rather they send their own status, happy or sad, or in stress, cortisol hormone. So those things they keep on sharing with each other, and it's like when one is upset, other gets upset too. So that is what we are going to learn, how our sharper mind, brain power is related to our gut, and what all can be done to improve our brain power through our gut. Gut is known as the second brain of our system. And that is why this is very, very important topic. And from last 2 decades, different research bodies and everyone is inquisitive about it, how it is related, what is the connection between the two. If your stomach is upset, will your brain also be upset? Will you feel sad, anxious as well? Or if you are in stress or you are anxious, will your stomach be upset again? So, what is the connection? So, we are here with Dr. Sagar Narodi, who is very renowned researcher in the field of Ayurveda, and he has not only completed his MD in the field and practicing, but he has also been publishing various research papers on the field, and he's very interested in these things, these topics. So we are very happy to have you, Dr. Sagar, in this platform. And Rama ma'am and me, Surabhi, will be your host in today's evening. And please share with us what is the connection between, because all of us want to know what is the connect between the two.
Good evening. Good evening, all. Thank you, Sister Surbi. So today's topic, which is like very interesting, very new, or some of you may know about it. So in today's this discussion, we will know about the exact relation between the gut and the brain. What is the importance of it, why it is so important that we are discussing in a lecture today, and what are the impacts, like if it gets affected, and how to maintain it. So these are all topics which we will cover in today's session. So what is brain gut axis? Like as so brain and gut is connected through the nervous system. As we commonly know that there is brain supplies through nervous system to various parts of the body. In the same way, there is one nerve which is called as vagus nerve, which originates from the brain, middle part of the brain, and goes up to the digestive tract and other parts of the body. So that is one connection through which the gut and the brain communicates with each other. Then there are some cytokines or hormones or some neurotransmitters which are secreted or generated in the intestines. They also communicate with the brain through various channels. And then there is an innate immunity, or which is called as gut immunity, which also has an impact on this connection. And then with the help of this bi-directional communication, our gut system actually communicates with the brain. It gives signals to the brain, and same vice versa, brain also gives signals to the intestine. So if there is any change in the intestines or the gut, then impacts the brain function. And again, if the brain is affected, or the secretions or the signals coming from the brain are affected, it impacts the gut health or the general digestion of any human being. So this is the brain gut axis. And earlier days, there was like only understanding, or there was only a notion of scientific understanding that there is only brain which is giving signals to the body or various parts of the body. But in recent researches, it is now proved that gut also has its own like nervous system or its own neuronal cells which actually communicates with the brain. And that's why, as sister said, it is called as second brain of the body. So it is as important as the brain. So this is it. So we'll go further.
Yeah, good to know about this new this thing, which I was not aware about it. Surbi ma'am, I was not aware about it. Thank you, doctor, about educating us about it. Yeah.
So Rama ma'am, should we launch this poll so that, because as you said, I was not aware. I think many of us are not aware because we hardly think about our brain, you know. Thanks to yoga and all these initiatives, we have started thinking about our health. After COVID, we are more serious towards our wellness approach. Otherwise, it was illness approach only. You become sick, you go to doctor. But now it is wellness oriented approach. You become so well, so fit that you don't need doctor, right? That's why Dr. Sagar is here, so that you don't need to go to him. He wants to equip us, right? So let's have this poll to understand what is our understanding.
Yeah, ma'am.
So I request everyone to please answer whatever you feel.
Mhm.
Are you able to see this poll?
Yeah, ma'am. We are able to see it. Yeah. Should I read the question, ma'am? Yeah.
Sure. Yeah.
Yeah. So the first question is, did you know that gut health is linked to brain function? If yes, then kindly go ahead. If no, then state it. So there are three options over here. Yes, I am aware. I have heard about it, but not sure how. And no, this is new to me. So these are the three options. Okay. Second question is, how often do you consider your diet when thinking about brain function? And there are multiple choices. So it is always, sometimes, and never. Good, ma'am. We are getting a good responses. Now,
75% people feel that sometimes they think,
yeah.
and 20% I can see they think that, I mean, they are saying that never. And 9% they are always thinking about, you know, food. When
So it's good that we are getting a genuine feedback.
Thank you everyone. Yeah.
Third question is, how frequently do you consume probably rich food like yogurt, then the kefir or fermented foods as such? So daily.
Probiotic. All of us know, no, nowadays children utilize Yakult.
Yeah.
Probiotic food.
Yeah, very true. A few times a week and never. So these are the options. And the question number 4 is, do you like a difference in your focus or mental clarity when you are well hydrated? So that's very, very important. That's why we do have a water bells also in the school, you know. So yes, absolutely, sometimes and never noticed.
So it's very good. If I mean, these are very genuine feedback, and it's important for all of us to be aware, because these small things contribute to our overall well-being.
Yeah.
So thank you everyone for participating.
And ma'am, the last question is, can stress affect your gut health, public digestion? And 85% have written yes. So, sir, Dr. Sagar will have to talk about it again, the brain and the stress connection and the gut connection also. Very good, ma'am. We have got a wonderful response from the audience.
Thank you so much, everyone, for this. And 70%, more than 70% people are affected with gut health problems. But we are not aware. And because we are not aware, we are not able to do certain things. Now, there are various concerns with children. I'll share few concerns with you. And request you to just say if it is, I mean, it is your feeling too. So can you see my screen now?
No, ma'am, not as yet. Not as yet. Yeah, now it's coming. Yeah. Yeah, we can see it now, ma'am. Yeah.
So these are few concerns with children that we have been experiencing in Brighter Minds. As you know, that Brighter Minds is to ensure cognitive wellness of everyone. We have structured programs for children, and we actually address these situations, how to increase concentration in children, because nowadays it is decreasing a lot because of a lot of screen time, lot of distractions children are having. There are various behavioral concerns. Please write in the chat if you resonate with one of the concerns that I am sharing. If you will be able to share your concerns, it will help us more. Third is increasing aggression. I mean, children are becoming more aggressive. Sometimes they feel lonely because we are getting many incidents in which children share with us, even parents share. Stress and anxiety is rising because of peer pressure and other pressures in children. They are becoming more impulsive in responses, fighting, bullying, all these things are increasing. And also cultural and societal changes have taken place. We all are in nuclear family system nowadays. Self-esteem issues also come because when children start becoming teens, they want to have their own place in the society, and then these concerns are seen more. Nowadays even children have these concerns, and screen time and technology. This is one toothpaste which has come out, and it cannot be, I mean, that paste that cannot be brought back into the tube, right? So it is already out. There is no alternative that we cannot use technology. We have to use technology, but then how to balance it out is something that we need to think. And even for adults, if we see, there are many adults, because Brighter Minds we have programs for adults as well, and regularly we are contacting adults, we are talking to them. Memory loss is something which we are observing nowadays, learning problems. We feel difficulty in remembering, recollecting names. नाम नहीं याद आते हैं लोगों के, events नहीं याद आती हैं. Something I have started doing something, but why I am here I just forget. So there are various concerns with memory nowadays, with many of us. Reasoning ability, we start feeling overwhelmed, so unable to take decisions. And then attention, just focus on one thing, that is not happening. We keep on focusing on many things. Multitasking is more nowadays, and we are not able to focus at present. Having difficulty with finding right words during conversations. Many people tell me that when I start giving talk, I forget what I was about to say. So all these are just manifestation I have shared here, and this is all there in the data. It's not my opinion that I'm sharing, it's in the data. You can see World Health Organization, they have covered this very beautifully, and they have also shared various interventions how to deal with it. That is why today's webinar is very important, because we are going to talk on one very important aspect. What can be done to address this concern in adults and also in children, those concerns. So WHO suggests that, apart from many other things, two important things. One, cognitive training has to be done for everyone. Second, nutritional aspect. And that's why this topic becomes of immense value, that we understand this, and not only understand, but apply in our life as well. So brain, whatever your anxiety level, stress level, everything is related, as Dr. Sagar said. So I would request Dr. Sagar to please share, sir, how this mood is affected, with gut, and what all can be done. I mean, what is the science behind it? I have heard good bacteria, bad bacteria, our body is full of bacteria. Please share with us.
Yes, so there are three important or main neurotransmitters which are secreted in the gut. First one is the serotonin, which we all know, like nowadays we know commonly serotonin, norepinephrine and dopamine. These three are very important. So serotonin, the total which is produced in the body, 95% is produced in the gut only. So earlier it was considered that it is only secreted by the brain cells or the brain part of the body, but now it is proved that 95% serotonin is secreted only in the gut. And that's why if it gets impaired, or that function of secretion of preparation of serotonin gets affected, then the whole system gets affected, because serotonin is required for memory function. If the serotonin levels are very low, then the person or the affected person will feel that he's not able to memorize things, or he's not able to recall the events or the things. And if it goes beyond the normal level, if it goes above the required level, then the person may feel anxiety or irritability. So balanced level of serotonin is very much required. Again, second one is the dopamine, which we know as a pleasure or reward hormone, which gives like motivation for like doing any new thing or doing our day-to-day activities. We need some motivation, and that comes from the levels of dopamine. If it is in balanced state, you feel motivated, or you are able to do your day-to-day life activities. And the studies, as in children's, they are motivated to do what they have to do. And if that level goes down the required levels, then the appetite and the overall brain function gets affected. And the third important one is norepinephrine, which is actually required for alertness, concentration, and overall energy. So if norepinephrine levels are very low, then you are not able to concentrate, or your alertness levels go down. And if it goes beyond the normal levels, or it goes higher the normal levels, then you feel irritated. And again, anxiety is the common symptom for serotonin and norepinephrine. So these three neurotransmitters are very much important, and they all are connected, or they all have connection with the gut. So if gut gets affected, the secretion in the gut gets affected, your brain function or your memory function, your focus, your alertness gets affected. So to maintain good mental health or good brain power, you need your gut to be healthy. So that's why this connection is very much important.
So suppose, sir, some child has concentration problem, and it can be completely reversed, understood, because in children neuroplasticity is maximum. But in case of adults, can it be reversed at any age? What is your experience?
Yeah, if the person is not having any clinical psychological condition, or the person is not dependent on antipsychotic drugs, then there is a good chance that if he changes his regular diet, his eating habits, his day-to-day activities, if he follows circadian rhythm, if he regulates his eating time and everything, then there will be a chance that the gut bacteria will change, the healthy gut bacteria will get re-established, and there is a good chance that these three neurotransmitters, the signaling mechanism from the gut and brain, will again be very normal or healthy. And then there is a chance that without any medication, with only change of diet, with only change in the digestive process, the person may get like completely improved from the clinical condition. But if the person is already like undergoing some antipsychotic drugs, or is already dependent on it, and according to severity, like along with some allopathy medications and the diet change, the person may slowly win off from the allopathy or from the antipsychotic drugs. And there is a good chance that he will regain his normalcy.
Yeah, it's good to know. But sir, I just wanted to know, when you say healthy gut, right? So how do we define that it is a healthy gut? I mean to say, I can understand, like, every day, having a clean gut is very important, or going at particular time, or having a set routine. But what is your definition about healthy gut?
So there is one concept in Ayurveda which is called as Agni concept. And we know that whatever we eat, we treat that process as yajna karma. Whatever we eat, we put it into that yajna, which is like the digestive fire, which is there in the stomach, liver, and small intestine, and the large intestine. The collective capacity of digestion is called as Agni. So if any part of that process is affected, then your digestion process, like, it will not be complete. So whatever we eat, it will not get like completely transformed into a form which will be assimilated in the body. So if whatever you are eating is getting completely digested, and whatever time duration it has to travel through the small intestine, then to the large intestine, and the absorption capacity of the small intestine and the large intestine is normal, and you don't see any food particles or any raw form of the food in the stools, or your consistency of the stools is normal, you don't feel bloated, and within 1.5 hours your stomach, you feel that your stomach is light, it is now completely empty, and you don't feel any regurgitation or acid reflux, then I think for the normal individual, that is the healthy gut. Like whatever he eats, which is good, properly processed, properly cooked, and gets easily digested, and the next day or after 36 hours or 72 hours, he don't feel any disturbance in his gut or any pain or any bloated feeling or any hyperacidity like symptoms, then the gut function is okay.
Yeah. Good to know. Good to know. So that
Because yes, yes.
yes, Surbi ma'am, you can speak, ma'am. Yeah.
Yeah. I just wanted to know because I have read that there are good bacteria and bad bacteria, and when imbalance happens, system is off it. So, what is your experience about it, and what have you to say about it?
So as in introductory line, as we discussed, that there are number of cells, like we consider our human body as a collection of cells, but the number of cells which are like there in the body, the total number, the number of bacteria are more than whatever cells which we have as a human body. So our body is not like ours only, it is more of the bacteria, and so whatever we eat is not for only for ourselves, we eat for the bacteria also. So it is
Yeah,
as
this
much
is very
there.
interesting. I'm loving this discussion that we eat for our bacteria inside us.
Yeah, because we have to maintain it. Our like our well-being or our existence is actually dependent on the health of the bacteria. If they are destroyed, we are gone. Like it is very rare chance that we will survive, because our body will get infected with some of the bad bacteria or some viruses, and then there is a chance that the systems will fail, and the person may die. So it is as much required as to live to maintain the good health of the, or the good number of the bacteria in our gut, or they are there in every part of the body. They are on our skin, they are there in the mouth, they are in our stomach, they are in the small intestine, but the larger number is in large intestine, the gut part of the GI system. So that's why it is more focused, or the discussion is more on the gut part of the intestines, like that is the large intestine, where this exchange actually happens between the good bacteria, and the balance is actually there, where like there are good bacteria and bad bacteria both present at the same time. If good bacteria, number of good bacteria go down, then the unhealthy or the unwanted bacteria flourish, their colonies grow, and we feel sick, or we may get some other infections or any clinical diseases. And then that's why to treat any disease or any chronic illness, there is a requirement to first establish good gut health. So in Ayurveda, we focus more on the GI system. So in Ayurveda, GI system, that is called as Annavaha Strotas, where the food travels, is more important than the brain or the lungs or the heart, because whatever happens in the gut will affect the brain, the heart, and the liver, or the respiratory system also.
So what I understand from this, we have to keep good bacteria in good condition, keep feeding them, and maintain balance. I mean, so that it can balance out the bad bacteria in our body. So what all can be done to feed these good bacteria in our body? And that is one of the questions too by Satya Prakash ji. Satya Prakash ji, you and me resonate on this question, because I also thought that how to increase good bacteria.
Yes. So first and most important is the balanced diet. So nowadays we have so many options, like we have so many processed foods available, so many packaged foods available. So these are all like impacting the good bacterias, like the processed food like maida and the other like which is available readily in the market. They are all affecting the good bacterias. They are killing the good bacterias. And like some terms, many of you know that probiotics, prebiotics, like these
Yeah.
are the supplements which we can give to our gut. So probiotics are the readily available bacteria which can be taken in the form of some supplementary tablet or some capsule or some powder form, which will directly give some amount of some number of good bacteria to the gut, and then the healthy bacteria will flourish and will grow to the normal expected levels. Then there are some prebiotics which are actually food like contents in our day-to-day food, like garlic, onion, some cereals, some green vegetables. They all have their own bacterial numbers. So they all have some bacterias, and they actually the contents of these products actually support the growth of the good bacterias in the gut. So prebiotics, probiotics, both are equally important. If you take prebiotics regularly in your food, like high fiber content products, like fresh fruits or
Yeah.
green leaf vegetables,
Yeah.
and the other like raw form of food, then there is a good chance that the bacteria will get what they have, what they want to digest. Of the substances our GI tract is not able to digest. So fiber is digested by the bacteria only. It is not digested by our alimentary tract. So we are like we should consume something which is actually required for the digestion process by the bacteria. So these type of like dietary changes we can follow that will impact the gut health or the good bacteria. Then second is hydration. Like water intake is very much important, which should be optimum. That will also improve the elimination process from the gut, so that unwanted toxins, the undigested food particles, which easily get eliminated from the system, so that the unhealthy or unwanted bacteria will not grow. If it remains there in the intestine, then there is a chance that the unhealthy or bad bacteria will grow on that undigested food material. So water intake, which should be in optimal quantity, is required to be taken every day. And then again, the third and most important is stress management. Stress impacts the digestive process, and again, affected digestion impacts the stress levels or the hormonal levels. And indirectly, again, this is like it becomes a vicious cycle. You are stressed out, and in that stressful situation, you are eating something that will not get completely digested. And then again, that incomplete digestion process will secrete the unwanted neurotransmitters, and that will again give bad signal, wrong signal to the brain, and this will go on. And then some or the other day you will get some lifestyle disorder like diabetes, hypertension, obesity, or fatty liver, or advanced forms of diseases, mental diseases like Alzheimer's, Parkinson's, dementia, and so on. Like new world's diseases you will easily invite. So that's why it is very much important to manage your stress, because that is going to affect your gut, and then that will be going to impact your longevity. Your overall lifespan will get affected because of this simple change in the gut. If you have to live 100 years at least, which is like considered in this period, then you have to maintain your gut health. Then sleep, again, adequate and good sleep, sound sleep is required. And then unnecessary medications like use of antibiotics. So this is a very questionable or very big discussion point nowadays, whether to go for antibiotics or not. Many people are avoiding. They are now become like they are educated now, or they are aware that antibiotics are impacting. they are having bad effect, but it is not always good to avoid, because in some cases it is required to be given, but many of times it is not required. Like many patients, like, or many people, they take without prescription also antibiotics. They take first or second prescription and then they follow it for the lifetime also. There are many patients, they visit once to the diabetes doctor and then they follow the same medications for lifetime. That is also wrong, and that that unnecessary use of antibiotics, then unnecessary or not required use of antacids. Like many people take antacids every day. That is also very wrong, because that is going to impact the stomach health and the intestinal health also, and again impacting the gut bacteria. Then many people have habit of consuming or taking NSAIDs, like painkillers. Without any reason, they feel little headache, they take painkillers. So that painkiller is also going to impact the acid secretion in the stomach, and again will impact the gut bacteria, because whatever comes in the gut, it has an impact on, again, on the liver, the gut bacteria. Yes, and that is a cyclical process. If you continue taking antacids regularly, then finally you will end up with some lifestyle related disorder like fatty liver or diabetes or obesity. Yes, so these kind of changes everyone has to follow, so that the gut bacteria or the gut health will not get impaired.
One more thing, I was just going through this, and because I also keep on researching, because of our Brighter Minds program, we keep on researching on these things. So please share something about leaky gut syndrome, sir, because that is very important for everyone to understand how different problems start in our body.
Very true.
Leaky gut syndrome is a very new world's disease actually, and it is because of the unprecedented use of antibiotics actually. There are many cases in many parts of the Western world and also part of our country also, that antibiotic resistant bacteria the number of antibiotic resistant bacteria is growing, or hospital acquired bacterial infections are also growing, because there is a unprecedented or uncontrolled use of antibiotics happening all over.
Sir, explain this a little bit, because our people may not be very aware about this leaky gut syndrome. So if you can just tell us about this, from the beginning, what it is and how it impacts our health, our people will be more aware and they will be able to take care of their health.
If anyone consumes antibiotics very frequently, then the gut gets affected. Again, the healthy bacteria get affected, and in the same affected condition of the gut, they start eating heavy foods or processed foods, or maybe their regular food also. If they don't follow some restrictions after the use of antibiotics, then there is a chance that indigested or incompletely digested food particles, or we can call it as toxins, they will enter the blood system. They will get absorbed through the gut, and they will enter the bloodstream. They will enter the neuronal systems like nervous system, and then they will start showing symptoms. Then the person may feel digestive issues. He will feel bloated, gassy, or he may feel sometimes diarrhea also. Then there is a fatigue, headache, which is actually not related with anything. Like the person is normal, he's not having any disease, but still he will feel like there is a fatigue. Then he may get some headaches, on and off headaches. Then there is a joint pain, some inflammation without any reason, without any previous history of inflammatory disease. And then there are chances of having eczemas or skin issues or simple hair loss. These kind of symptoms, like it is a group of symptoms, and the person may get one or two of these symptoms, and there is no
because intestinal lining becomes thinner when we take antibiotic?
Yeah. Okay. So with the use of antibiotics, the healthy gut bacterial number goes down and the unhealthy bacteria grow in more number. So predominance of unhealthy gut bacteria actually impacts the digestion, and then the nutritional lack happens. So the person gets lack of nutrition. The person don't get the required nutrients like vitamins, minerals, and because of that, the affected body part will start showing the symptoms of some of the diseases. That is called as leaky gut syndrome, and there is no treatment because there is no any medicine which will directly impact the affected gut. Only probiotics or prebiotics which is now tried for this. But if it is chronic, if the internal lining of the gut is affected from a very long time, there is a rare chance that it will regain its normalcy. That's why.
So, like
And
Rama ma'am
nowadays,
might say, yeah, sorry.
yes.
Please
So
continue, sir.
nowadays we see so many autoimmune diseases. Like the doctor says there is no reason. It is just coming. So these type of things are coming from this leaky gut syndrome. There is no specific reason of having that disease. Like cancer also, there is no specific reason. But nowadays you see like in every household actually, in few years you will see that one or the other person is getting affected by that. It is because of this autoimmune system affected. This immune system is like totally impacted by the like an uncontrolled use of antibiotics, and that is actually a long-term impact. You will not see it within a year or 2 years, but maybe in 10 years, 15 years, the person will get these kind of autoimmune diseases if he continues to use these unwanted like medications like antacids, painkillers, or antibiotics.
Like Rama ma'am was also not well a few weeks ago. We were also not well, and many of us get sick and we go to doctor, sir. And when doctor advises antibiotic, we don't have any, option. I mean, we don't have option, all of us, right? So tell us something which we can do to address this concern. Give us few more tips what we can do at home, what all measures can we take, what all support can we get from this Ayurvedic ancient knowledge of science, so that all of us can address that concern. That's why we need help from you.
Yes. So Ayurveda's first target is to maintain good health. Swasthasya swastha rakshana. So one who is already healthy. So Ayurveda advises so many things to maintain that good health. If the person is affected, then there are like good medications or good panchakarma procedures, or there are many options in Ayurveda also. But the first one is to maintain swasthasya swastha rakshana. Then second comes aturasya vikara prashamanam cha, like the treatment of the deceased person. So in Ayurveda, as I earlier said, that Agni concept is very much important, which is there in the stomach or the digestive tract. So maintaining Agni is important. If you don't feel eating something, or if you don't feel hungry, don't eat. If you feel that your stomach is full, or like there are three types of like eaters. Like one is yogi, other is jogi, and the third one is bhogi. The one who eats 1/4 part of the stomach is yogi. One who fills it with half of the food is jogi, and the one who fills it three parts of the stomach is bhogi. Like if you follow the middle one, the central, the second option, that you feel your stomach only half of its actual capacity, then that food will get easily digested. Then keep that one part for water and one part for air. Like it should be empty for proper digestion to occur. So that is one thing. You follow your gut feeling. That is, again, it comes to the gut feeling that you are not, if you feel like sick, or you feel that your digestion is not good, avoid food on that day. Drink only lukewarm water, or just do fasting, like maybe for 8 hours, maybe for 12 hours, according to one's own capacity. You can fast. So fasting is also a good remedy for like maintaining good health or avoiding diseases. And many a times you get the in Ayurveda, there are not just symptoms, but there are purva rupas explained actually before the disease actually happen. There are rupas and purva rupas. Rupas are actually symptoms, and purva rupas are the precursors or the symptoms which are seen before actual disease comes to the picture. So in purva rupa or in that stage only, if you avoid eating, if you consume lukewarm water or you take some like dry ginger powder or simple triphala like medicine, then there is a chance that that process of disease happening will break down and the person will not get diseased.
Yeah,
And
so that is
everyone gets these
important
symptoms.
part that you have shared, sir. I would request you to please write in the chat also these important tips like Triphala. So how to use it and for how much time should we be using? Because if we keep on using regularly, then we have some fear, right? Our stomach will become habitual of that as well. So please give us exact things so that we will be able to follow.
Yeah.
Yes, Triphala is a combination of three herbs, three fruits actually. Three phala, three is three, and phala is fruits. So it is combination of Hirida, Beheda, and Amalaki. These three fruits are there in the combination. So it is a very balanced combination. Haritaki is like Terminalia, Chebula is the scientific term. It actually helps to eliminate the toxins. Then Beheda or Bibhitaki, it actually improves the intestinal cleaning process and the it impacts the pores or the openings of the intestine. And Amalaki, which is Avla, that helps in removing the unwanted food particles or the undigested food, and it also impacts the secretions happening in the intestine or the stomach and the large intestine. So it is very balanced. So it impacts the Vata, Pitta, and Kapha, as maybe many of you may know that Ayurveda focuses on these three terms actually: Vata, Pitta, and Kapha. These are three life forces, or these are three forces which actually govern or which actually maintain our physical form or physical body. So to balance these three things, this combination is used. But again, if you use it for longer time, then there is a chance that you may get habituated to it, or your intestine will it will impact negatively also. The absorption from the gut will also get impacted. So very moderate use of Triphala is required. It should be used whenever you feel some like hyper acidity or some indigestion or heaviness in the stomach or in the intestine. Then and then you should use it for some period of time, maybe for 1 day, for 3 days, or 7 days, or 15 days, and maximum up to 21 days according to the condition. And again, you can take some suggestions or some prescription from the Vaidya.
Maximum 21 days, right?
Maximum 21 days. It is not advisable to continue it for longer period for stomach issues. In disease condition, the doctor or Vaidya may give it for 3 months or 6 months also, but it is again given for specific disease condition, not for healthy individuals.
So for healthy individuals, they can start from 1 day, 3 days, maximum up to 21 days, but don't go beyond it, right?
Yes.
And
Yes,
if
it is very
possible,
much.
follow with doctor's advice if you want to go ahead, right? For more time. So
Yes.
Satya Prakash ji is asking, please explain the proportion of Triphala. And Sunila ji is asking, when should we take these? At night before sleep, should we take that? Or when?
So if there is any issue with the bowel like clearance, like the motions are not regular, or sometimes you get constipation and sometimes you get loose motions, or there is like any symptom related with the digestion, then you can take it at bedtime with some lukewarm water. Like if you are taking it 1 gram, you can take it with 60 ml of lukewarm water. So according to age, the dose will again be different according to the condition, but normal dose is 1 gram and maximum is 3 grams, not more than 3 grams.
Okay. And in market, we get Triphala powder and Triphala tablets. They are good enough, right?
Yeah, because Triphala is very readily available in India. It is grown in various parts of our country only. So it is like there is no adulteration or anything happening in Triphala at least. Other herbs, there is a chance that there may be some adulteration or some malpractices, but Triphala is okay, like it is available in good form. Yes.
Because Ayush ji is asking, in what proportion should Harad, Baheda and Amla be taken for Triphala? What should be the
Okay.
proportion?
Okay, for common understanding, it is equal proportion. Like if it is like 1 gram of Triphala, 1 gram of Harad, and 1 gram of Amalaki.
Hmm.
Like everything 1 gram in equal proportion. Yes.
Okay. So Chandrakant ji is asking, sir, Triphala can be taken thrice a week also regularly?
Yeah, if required, yes, alternate day or like every day for 7 days, that is also advisable. No problem.
But
As I
don't
suggested,
beyond 21 days. Huh?
but don't go beyond 21 days.
Hmm.
If you have to take it up above like more than 21 days, then you should consult someone. Yes.
So Prakash Kumar Chaudhary ji is asking, can one take Triphala once a month even without any problem? Suppose I am a healthy person. Can I take it once in a month or so?
If you eat any outside food or any heavy food, then only you should take it. Otherwise, it is not required. If your gut is good, your health is good, then there is no need. You can consume then Chyawanprash like supplementary food for maintaining good health. Then not
Chyawanprash. Chyawanprash.
Yeah, Chyawanprash like other like many options are there to maintain good health, to reduce that oxidative stress which is coming every day.
So Triphala can be taken as appetizer also, and Chandrakant ji is saying I take it empty stomach.
Yeah, there is yes. Can be taken on empty stomach also if the person is having regurgitation or acid reflux like symptoms. Then he can consume it just before having food, like 5 minutes before food, or can be taken in empty stomach early in the morning, so with lukewarm water. Yes.
And can Triphala be taken as appetizer also?
Yeah, yes, it will help as appetizer also because it neutralizes the excessive acid secreted in the stomach. So it can be used for that reason.
And during
also.
our discussion, you were sharing something about aloe vera also, sir. So can you please share about that as well?
Yes, there are many herbs explained or available in the texts of Ayurveda, like Guduchi, Terminalia, then this Triphala, then aloe vera. These are all herbs which actually reduces the oxidative stress. These are all helping our immune systems to regulate the oxidative stress which is happening because of our lifestyle, because of the stress. And because of the low oxidative stress, there will not be any degeneration happening or occurring in the body. So to reduce that degeneration process or to lower down the aging process, these kind of Triphala or aloe vera, Guduchi, these kind of herbs are helpful.
Okay. So Prakash Kumar Chaudhary ji is asking which Chyawanprash is recommended because there are many available in the market.
Okay, that is a very difficult question actually, because there are many references of preparation of Chyawanprash. So very few pharmacies follow the actual process. Many of the Chyawanprash samples which are there in the market, they have more than 60% sugar in it. So it is not advisable to go for any famous brands. You can search, or I will share the names which of few companies which prepare the Chyawanprash with the authentic method only, and they have very less amount of sugar added to it. Because otherwise, then the person will get the bad effects of sugar again.
Then so, that one more problem will be added.
Yes.
Yeah. So regarding all this particular webinar, because we are towards end, last 10 minutes are remaining. So what I'm thinking, there is one YouTube link you can subscribe, because we keep on sharing various topics related to our health, parenting, and all these family concerns. So you can join that YouTube. And also we have one WhatsApp group which you can join. I'm sharing the link with you. And if you have any questions, you can, post in that WhatsApp group as well. And what Dr. Sagar would be sharing with me, I would share with you on that WhatsApp group. I'm also sharing with you one LinkedIn profile. You can just follow and share our things with others, so that you will be helpful for others as well, because the purpose of these webinars is to create awareness. Dr. Sagar, as we were discussing, Dr. Sagar's grandfather, he fell in bathroom, and then then there was some this thing problems, and then one of our more parents, her mother, she fell in the bathroom, and I would
Ma'am,
share
I
with
have
you
a
that
question.
we have
I put in the
conducted this.
chat box. It's a very simple question.
Just one.
I'm 65.
Just 1 minute. What I am sharing is we conducted one webinar on how to take care of your balance in elderly age, so that you don't fall down. So what I would request, please subscribe to this YouTube channel and go to these previous webinars, so that you can take care of your elderly people at home. So that is very important part, to take care of yourself, your elders, and also your children. That's why I have shared this WhatsApp group link and this LinkedIn, and also our YouTube subscription link. Okay, so
Yeah. Surbhi ma'am, I had one this thing. I wanted to ask Dr. Sagar that drinking buttermilk, is it really very helpful for the maintaining a good gut health as such?
Yes, so it is one of the very commonly available probiotic food in our all like families. It is very readily and easily available, and it contains lactobacillus bacteria, which actually helps to promote the secretion of some enzymes or some chemicals, which actually impacts the growth of bad bacteria. So to maintain the good bacteria, use of buttermilk is very much advisable. One can take it every day also after having lunch in the daytime. And as we all know, that milk products should be consumed before sunset. So in the daytime, after lunch, just after lunch, or during lunch also, or 2 hours after lunch, buttermilk consumption is very much advisable. And according to seasons, one can change the composition of the buttermilk, because in Ayurveda there are 5 types of buttermilk explained, like adding equal quantity of water, adding twice the quantity of water, adding thrice the quantity of water, and not adding any quantity of water or any part of water. So these are all types of buttermilks, and everyone has different impact on the digestive process. So according to season, like in summers, you can add more water. In other seasons, you can add like twice of the quantity of the water. Then there are methods also, different methods also to prepare the buttermilk. Like one is prepared by the hand only, like hastashvita, like there is one Sanskrit term that you can just prepare it by using your hand. Then second is by using some churning instrument.
Yeah.
And then some use it by filtering it by removing the butter which is present in it. Or some are like some people use it directly along with the fat which is there in the buttermilk. So according to the health condition, according to the age, one can remove the fat or one can use it.
Yeah. That's
And we
really
can
good.
add some, yes,
Yeah.
yes, some dry ginger powder, black pepper, or
Yeah.
some coriander seed powder. According to season, like there is a like so many options available. Like you can change the form of buttermilk or the contents of the buttermilk.
Yeah. That is
Yes.
really
great. It's very helpful for everyone, sir. And yeah, so as someone asked in the group that WhatsApp group link was reset, I am sending it again. New link. I mean, you And there are a couple of more questions. Sometime back, I was advised to take calcium tablets in the night after meal. Will continuous use of these calcium tablets affect our gut? Professor Vasanti ji.
Yeah. Yeah, she wanted to speak, ma'am. Yeah, yeah.
Oh, she wanted to speak?
Yeah,
Okay.
yeah. So she has written the question. Yeah, yeah.
So you can unmute yourself, Professor Vasanti, and you can ask.
Yeah, I just wanted to know because last 3-4 years I've been taking it, but is it harmful? I wanted to know.
Actually, if you are
For the
not
gut.
getting any, if you are not getting any symptom of acidity or any constipation, then you are easily, like, your gut is able to digest it. But many patients, I give calcium supplements or Ayurvedic natural calciums to many patients. As compared to allopathic, like the chemical form of calcium, the natural calciums are easily digested. They don't create any gut disturbances, and they are like, if you are taking 100 milligram of pill, the 90 milligram will get absorbed. But if you are taking an allopathy tablet which is of 100 milligrams, then there is a chance that it will get 50% only absorbed. So if you want
The tablets
your
only are 500 milli, not less.
yeah, I'm just giving an example that if it is like of 100 concentration, then allopathic, that calcium tablet will only get 50% absorbed. And if you take any natural form of calcium, then it will get like up to 90% it will get absorbed. So utilization is more in the natural form. But
Okay.
if you are like able to maintain your blood calcium levels, you don't have any arthritis, or if you don't have any osteoporosis with the use of same tablet, then you can continue using it. There is no issue.
I have knee problem developed now. I've been
Okay.
told it's arthritis. That is why I was a little worried. And yes, I've been getting constipation time to time.
Okay. Okay. So then you can change your calcium also if required. Yes, if you are not
Okay.
like getting pain relief, or if you don't feel that your bones are getting stronger day by day, the osteoporosis is not going down, then you can shift to some other form of calcium.
Yeah, it's not going down.
So
I
I'm
should
sharing.
stick to natural.
Can you
The
please?
last question was, should I shift to natural calcium then?
Then you can consume natural calciums, like the Ayurvedic forms of like natural calciums.
All right. Thank you, sir.
Yes.
Thank you for asking. I'm sharing my number as well in case you have some query after this program as well. You can send your query to me directly as well. And Neela ji is asking, consumption of multivitamins, is it good or will it have gut disorders? Please, can you answer this, because these days many people take multivitamins.
It is very like the pandemic is actually of vitamin malabsorption. We have seen COVID and everything, but we are actually undergoing a pandemic of vitamin malabsorption. And it is because of this gut affection or the affected gut bacteria. As we commonly see nowadays, that everyone who goes for any blood test, many doctors suggest go for vitamin D and for B12. So in many cases, the person is if the person is non-vegetarian also, he is also having the issue of low B12 levels. It is because of the B12 is actually generated by the gut bacteria. If they are not good, if they are not healthy, then if you take supplements also, it will last for a very short time. Then your blood levels of B12 or the deposit in the part of the body will also go down in very short period of time. So maintaining good gut health is more important than consuming vitamins or supplements actually, because many vitamins or the micronutrients, they are generated or produced in the gut only. You don't need the supplements actually every time. In old age, or in some cases it is required in some disease conditions like Crohn's disease or where IBS is for a longer period of time, there is a requirement of giving some supplements. But if you are normal individual, you don't have any chronic disease, then you should focus on your gut health first. And then if your gut health is good, then if you use supplements also, that will get utilized or that will get absorbed easily. And then your levels of nutrients or micronutrients will be in balanced condition, or it will be in optimal level only. So first focus on the digestion and then go for supplements. Any form of supplement like proteins or any like B12, calcium, or vitamin D, or any vitamin supplements.
Thank you, sir. Pushpa ji is asking, I was suffering with uterine fibroid. I was continuously on medicine for 5 years. I want to know that how much this treatment damaged my gut and what I should do to keep my gut healthy.
Okay, so it will depend on what medications you are like taking or regularly consuming for the same reason. If it is hormonal, or if it is like having an impact on your digestion or your day-to-day hunger feeling, your bowel movements, then you can think of like taking some probiotic along with your other medications. Probiotic is very much like will help in this condition.
So include these natural probiotics in.
Natural probiotics or prebiotics, like change of food. Like you can start consuming some healthy food or unprocessed food.
Many people come to me, sir, for this Vitamins program, adults and also children, their parents, and they keep on telling me that I eat healthy. My child also eats healthy. But even then, nothing is absorbed. What should I do? Oh, दुबला ही उतना ही दुबला है जितना दुबला था. Weight is not gaining, height is not increasing. So, what would you suggest for that?
Yes. So again it will come to the gut bacteria. Our interaction, the human's interaction or the newborn's interaction with the bacteria starts from the day of delivery. Actually, in normal delivery, when the baby passes through the vaginal canal, the first interaction with the bacteria happens there only. The vaginal or bacteria, then the mother's bacteria which are present on the mother's skin, her hands, they all impact the baby. The baby gets these bacteria very readily, and then the colonies actually grow in the intestines. But nowadays you see, or all like we see that LSCS or the cesarean sections are happening. So that first interaction with the bacteria is like very rare nowadays. So that is also impacting the intestinal gut health of the children's or the younger ones. And then the second is processed foods like dairy products or the chocolates, or like use of sugary products, then the processed maida and all. It is actually impacting the actual colonization of the bacteria, the growth of the healthy bacteria, and if the and also the use of antibiotics in childhood days, in early days of the childhood. So these are all reasons that because of this, if you give healthy food also, because of that impacted gut or the affected gut, the nutrients are not getting absorbed. And because of this affected gut, the children are showing symptoms of like ADHD or autism spectrum diseases, or simple anxiety, stress, or they are showing all kinds of mental illnesses in very small age also.
So Ayurveda can help in that.
Yeah, in Ayurveda we can give some medications, some like detoxifying processes like Panchakarma, and that will reset the gut bacteria. And again, along with dietary changes, some medications and some detox processes, this can be achieved. Yes, and there is a good chance that the clinical condition will also get reversed, and the child may become very social or will become normal individual, will grow as a normal individual.
We still have few questions, but our time is up. It's already
Yeah.
8:35. So what I would request, if you are getting late, then you can leave. And Dr. Sagar, are you okay if we take few more questions, or are you getting late, or you need to go somewhere?
Yeah, it is okay. Yes, we can continue.
Doctor, I have one quick question.
Yes, yes, sir.
Yes.
Preeti Gupta wants to
Yeah.
ask. Yeah. Yeah.
Yeah. Namaste, doctor. Namaste, ma'am.
Namaste.
Yeah, I have fatty liver,
Okay.
grade 2.
Okay. Yes.
So is it possible to reverse, and how to reverse? This is my question, doctor.
Yes. 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 Very common problem nowadays. Anyone who undergoes ultrasonography or USG, he may get diagnosed with grade 1, grade 2, or
Yeah.
maybe grade 3 of fatty liver changes.
और
And
सर
many
एक
people.
चीज मैं सबके लिए क्लियर कर दूं कि पहले आई मीन अर्लियर वी यूज्ड टू थिंक that because we consume alcohol we get fatty acid, but it's not the case. Even without alcohol you can get that.
Yes, ma'am. Yes, ma'am. Same thing. I felt that those who are drinking, they have grade 1, and I am not drinking, I got grade 2. So I am really depressed that time.
Yes.
So I asked the doctor, so they told us that it is stress or what you have, like that. So,
Yes, yes.
so how to reverse? That is the main point.
So we'll first discuss the reason of having fatty liver.
Yeah.
Actually, it is very common, and very non-alcoholics have it. Actually, more non-alcoholics actually have it than the alcoholics, because it again comes down to the gut bacteria. If your gut bacteria are affected, your digestion is affected. Whatever you eat, the incomplete digested food particles, the toxins which are coming out of that unprocessed or incompletely digested food, they get absorbed through the gut, they go into the bloodstream, and from that bloodstream it goes to the liver, and then that gets deposited in the liver, healthy liver cells, and your liver starts getting affected. And day by day, like, it is not a process which occurs within a very short span of time. Like, it may take 1 year, 2 year, or maybe 5 years also to go to that state. Like, grade 1 also may take like 5 years or 2 years also to form. So again, to reverse it, you have to focus on your digestion again. You have to reverse it through detoxification processes of, like, Panchakarma. There is one process called Virechana, where we give 5 days or 7 days or 10 days of ghee, medicated ghee, to consume in a larger quantity or in increasing dosage. And then on the last day of the process, we give some purgative medicines, which actually cleans the intestine. It opens up the pores or the openings of the intestines. It removes the excess secretions or the bile which is stored in the gallbladder, or the secretions which are there in the liver cells. And then after this loose motion or the Virechana process, there is a specific diet to be followed for next 5 days or 7 days, or maybe for 10 to 15 days. With the help of these kind of detoxifying processes, there is a good chance that your liver will go from grade 2 to grade 1, and then it may, like, completely get reversed to normalcy also. Yes. And to maintain that healthy liver, you will have to maintain your good health again. Otherwise, it will again get affected by the same indigestion or malabsorption, and it will again reoccur the same condition.
And
Right, sir.
I want to add one thing, Dr. Sagar. With these relaxation techniques, detox techniques
Yeah.
with heartfulness, you can even try it, Preeti ji and sir. You can even try
Yeah.
these methods. And in Heartfulness Institute, 95% offerings are sponsored by Heartfulness. We work on pay forward method, and 5% offerings in which investment is high, we charge. So you can try these meditation techniques, relaxation techniques. It will also add to it. Dr.
Very
Sagar, would you like to say something
Yes,
about
yes, because meditation directly impacts the stress level. It impacts the immune system. It impacts the gut bacteria also. It impacts your viveka also, because whatever comes into your thali or your plate, you will start recognizing it, whether this is healthy for me or not. You will start eating mindfully. Like if you do regular meditation, then slowly your everything will change. Like your dietary habits will change, your life cycle will change, your circadian rhythm, like your day-to-day routine will change, and naturally your stress levels will go down, and with that reduced stress level, your disease condition will also get reversed completely. So meditation is again one of the easiest way to reverse any chronic illness or any chronic disease.
And for children, we have beautiful techniques of Brighter Minds, because for children, it is very important that you give them practical techniques. We keep on telling focus, 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 but it doesn't happen because we are not giving them practical techniques. So you can even try practical techniques of Brighter Minds for children. And with these beautiful techniques, like I can share with my experience, I'm with this organization for last 30 years. Rama ma'am has also been, practicing, and even Dr. Sagar has been practicing mindfulness. And from personal experience, we can share that you will get that benefit. These are practical techniques, beautiful techniques. So you can give it a try. And there are few more techniques. Maybe in one more webinar, we will share, Dr. Sagar. Actually, I have many more questions like you all. Like, किस तरह का बर्तन use करना चाहिए? What is the process of preparation of food? All that we have in our mind. Maybe in one of more webinars, we will invite Dr. Sagar and take it ahead. Thank you, Preeti ji and sir, for asking. There is one more question by Manila ji. Do millets also increase probiotics? Tell something about millets, sir, because it is very much in fashion nowadays.
Yes.
Yes, gluten intolerance is very common nowadays. And the homegrown or the locally grown grains are very rarely used nowadays. So that's why again, everyone is now focusing on the alternatives to the wheat actually, because the gluten is impacting the gut health actually. So for after use of long-term use of wheat is causing obesity, diabetes. It is affecting the cholesterol levels also. So using any alternative to the wheat is very good or is very important nowadays. At least once daily you can use the alternative to wheat, and one time you can eat. If you are able to digest it, one time you can eat wheat, chapati or anything, and then the other meal you can have millets, any locally grown millet.
It will have good impact on the gut, right?
Yeah, it will have good impact because it contains fiber more than the wheat. And fiber is important for the bacteria because fiber is digested by the bacteria only. Our gut is not that capable of digesting the fiber actually. So gut bacteria only digest that fiber. And to maintain their colonies, they require it. If you eat only maida, only processed flour, then the gut bacteria will not survive. That's why millets is important.
Yeah. So remember, Mr. Chandrakant Singh has raised the hand. Can you see it? Yeah.
Yes, Chandrakant ji.
Yeah. Yes, I will not take much of your time. I take curds from my childhood, and doctor mentioned about buttermilk, but I want him to tell something about curds, like dahi, little of dahi we all every day take, and many South Indian families I have seen, they take curd. And second question is about sugar intake. I have read that the sugar increases bad bacteria. So these are the two questions that have general questions.
Yes. So consumption of curd is very good. It is not bad actually, but in some parts of the country, like in these western part or in northern parts, according to the seasonal variations, according to the atmosphere, use of curd is restricted, or many Ayurvedic practitioners, they say to avoid curd actually. But in South India, the atmosphere or the surrounding is like that the person is able to digest it very easily. And again, it comes with the good bacteria, that lactobacillus is there in the curd. So use of curd is also good. And if the person is like, if it is like the person is aged, or if the digestion is not good, then use of buttermilk is easy because it will not create any gastric trouble. Because curd is heavy to digest because it comes with that fat also, that cream part also. So the buttermilk is easy to digest, but curd also comes with the same lactobacillus bacteria. In Ayurveda, it is said that takram shakrasya durlabham, like it is not available to Indra also. It is that good that one can like use it every day, and it is like amrit of this earth. In this way, it is like explained actually. And the what was your other question, sir?
It is
Second.
about the sugar intake.
Ah,
I have
yes.
read that sugar is harmful. It grows, bad bacteria grow in the intestine.
Yeah, it is very true or very correct, sir. Because higher sugar levels actually impacts the absorption of nutrients from the gut. It impacts the internal lining of the gut, and again, the bad bacteria, they grow easily if the blood sugar levels are very high. So use of sugar is should be like restricted or should be used very moderately. Or other forms of sweeteners can be used, like other than the white sugar, the processed sugar, like jaggery
Thank
or
you very much,
honey.
sir.
Yes.
Very good webinar. Excellent.
Thank you, Chandrakantji. Thank you for joining this.
Thank you.
And one more question from Purnima ji. I have been taking anti-acidic tablets for more than 5 years. Will this affect my guts? I always have acidity problem. If I miss this tablet even for a day, I feel uneasy and my BP boosts up. What should I do? Please suggest. Purnima ji, if you want to come on the webinar, you can put your video on. I'll give you a spotlight. Dr. Sagar, this question is for you.
Yes. So this is not good to consume antacids for this longer period of time, because it will definitely impact in longer time, that it will impact your stomach health also. It will impact your liver health, because whatever we eat, it will first go to the liver and then it will be distributed in the body. So liver will also get affected because of the chemical form of the medicine. And then the elimination part, like kidneys, will also get impacted, because whatever is toxin or whatever is not required will get eliminated through the kidneys, or the digested medicines will also go out of the body system through kidneys only. So it will have to work more. So it is better if you shift to some natural form of antacids, like some herbal medication or some Ayurvedic medication. And again, the detoxifying process like Vamana, like medicated vomiting, will help, because it will remove the excess acid. It will impact the stomach. The acid secretion will get regulated, and your overall digestive process will get it will be improved with the help of Vamana process. Or if you are not, like if you have any hypertension or other diseases, then the doctor will suggest you to go for Virechana, that is purgative medicines. That will also reduce the acid secretion, will positively impact the overall acidity. So you have other alternatives rather than consuming only the antacids. So go for other alternatives. It is not good for this longer time to consume.
Thank
Purnima
you.
ji.
Thank you so much.
Yes.
So I'm
There is
sure
one question that any home remedy is there, like antacid. So
Yeah.
coriander seed water is the easiest form of medicine, which can be used from the kitchen only. Coriander seed water, then jeera water, that also is used to, but again it will depend on the symptom and the cause of the hyperacidity.
I
Then simple ghee will also reduce the acid secretion. Will also
I
impact
take chia seed. Chia seed I take, sir.
food. It reduces heat, so it is also good. Yes. Yes.
Thank
So
you.
according to the of the condition, you can use the home remedy also. Yes.
So thank you, Purnima ji. Neela ji is asking, sir, maybe few last questions. Neela ji is asking, can you please suggest natural antacids available at home? Neela ji, if you put your video on, I'll give you a spotlight. Natural antacids available at home.
Yes, as I just said, ghee, cow ghee is the easiest and easily available, which gives a protective lining, which creates a protective lining in stomach wall, and it regulates the acid secretion. Then coriander seed water, then sabja seed, sister said, Poonam sister asked about. These are like natural and easily available in everyone's kitchen. And again, you will have to find out the cause of acidity. Actually, if it is constipation, then the home remedy will also be different. If it is only the acid secretion or the spicy food, if you are consuming, then the home remedy will be different again. Use of simple lukewarm water on empty stomach also regulates the acid secretion. That is also
In the morning, we all can have it.
yes,
that is
yes,
better.
yes,
Yes,
that is also easiest way.
Okay. So Saraswati ji has one question. Yes. So you are asking me, Saraswati ji, you can send me message because I have already given you my number. And yes, I think this is all. If we are leaving someone's question, you can just raise your hand and ask if something important remains. Rama ma'am, do you see some important
No, ma'am.
questions?
Yeah. No, ma'am, we have covered maximum questions. Okay. I'm also scrolling down from this chat box. So we have, does gut bacteria get treated with alcohol?
Question.
Yes.
Ask
As
that
we
question.
all we all use sanitizers in COVID
But
era.
there is a white sticky ejection from vagina regularly. So I don't know why it is happening, and it's lately happening very often. And sometimes I've seen very small blood spots also. And this
Okay.
usually happens in the afternoon.
Okay. So there may be a chance that you have some candid infection, some unhealthy bacterial infection in that part of the body. And because of that, you are seeing all these symptoms actually.
So, sir, in
Yes.
case
And
someone,
again,
can I share your number with them just in case someone asks for it?
yeah, no problem. Yes, I will help. Yes.
Are you okay to take the call?
Yes, yes, yes. Okay.
Thank you.
Yes.
Thank you so much, everyone, for joining. Thank you, Dr. Sagar. Thank you, Rama ma'am.
Thank you, Dr.
Thank you,
Sagar,
everyone.
patiently answering all questions. Thank you so much. Thank you.
Thank you, Dr. Sagar. And we would request your presence once more in one of the webinars because someone has written, Dheeraj Chawra ji has written, very useful webinar, eagerly waiting for part 2 of this one, as many of us have a lot of questions to be answered, sir. So request your permission to invite you one more
Yes,
time.
definitely we will plan second part of this. Yes. And
Thank
thank you, Sister Surabhi, for giving me this opportunity to discuss this very unique subject. Thank you.